Welcome to the October 2024 meeting of our nonprofit plant-based nutrition organization of Wisconsin, or PBNOW. I'm your host, Terry Lynch. The mission of our nonprofit group is to educate, inspire, and support each other on an evidence-backed, whole plant food-based nutritional path for a healthier, happier life. Our group is open to everyone, those plant-based and those just curious about it. And it's meant to be a non-judgmental place to come get information, inspiration, and support. If you'd like more information about our group, our upcoming meeting dates, speakers and resources, or just to check out videos of our past meetings, Google us at pbnow.org. That's pbnow.org. As we do each time, can I see a show of hands or thumbs up reaction icon on the bottom of your Zoom screen to show how many of you are currently following a predominantly plant-based lifestyle? So I'm seeing the thumbs come up and some hands there as well. Looks like, boy, I'd say at least probably a third of the group so far. That's great. Thank you. As we mentioned at the beginning of each meeting, the evidence of the benefits of plant-based nutrition in improving health and quality of life for people of all ages, as published in non-biased medical research, is quite striking. Whether it's improving health through increased energy, weight loss, preventing, slowing, or stopping or reversing problems like allergies, digestive problems, diabetes, heart disease, and early dementia, or increasing our quality of life by helping us feel better quickly, strengthening our immune system, increasing our endurance, improving athletic performance, speeding recovery from exercise, reducing joint pain,
audio enabled and video enabled.
Clearly reducing joint pain, clearing thinking, or reducing the physical, emotional, and financial side effects of the illnesses, drugs, and procedures often recommended to treat the conditions plant-based nutrition can help us avoid. The research shows that our bodies do a wonderful job of healing themselves. We stop inadvertently damaging them daily with poor nutrition and start giving them the nutrition they need to heal and function optimally. It's truly remarkable. Now, let me tell you what's in store for you tonight. Tonight, we'll hear from three speakers. Our first speaker will be vegan chef Melanie Manuel, who will share a tasty plant-based recipe with us. Melanie will be followed by our featured speaker tonight, cardiologist Dr. Aimee Welsh. Dr. Welsh's presentation will be followed by a few minutes of Q&A. And then our third speaker, PBNOW Medical Director, Dr. Joshua Liberman, will finish with 10 to 15 minutes of comments and a patient story. Tonight's program should end at 7:30. As a reminder, we have meetings every month, usually on the second Thursday of the month at 6 o'clock Central Time. Next month, our featured speakers will be Ann and Jane Esselstyn. Many of you, I'm sure, have seen Ann and Jane in the past, and they're a lot of fun and bring a lot of great information as well. We'll also hear from Dr. Liberman and plant-based coach Michelle Stamm next month. I think you'd enjoy it. In the future, we'll be hearing from California plant-based mother and author Rachel Brown, plant-based icon Dr. Michael Clapper, American College of Lifestyle Medicine past president Dr. Kate Collins, among others. I hope you can join us for some or all of these. We'll post more information about our upcoming meetings on our website, pbnow.org. If you register on the website or are already registered, you'll receive email reminders of our events as they approach. Last, a quick technical note. During the meeting, everyone but the speakers will be muted, and we ask that you stay that way to help avoid background noise and to allow everyone to be able to hear the speakers that they tuned in to listen to. All right, here we go. Our first speaker tonight is a chef, caterer, and former owner and chef of the popular Milwaukee East Side vegan restaurant, Cafe Mana. I think I've got that right, Melanie. She will be sharing a tasty plant-based recipe with us tonight. I'm pleased to introduce to you Chef Melanie Manuel. Melanie?
Hi, everyone. Can you hear me okay?
Yes.
Great. I'm in kind of a funny setup because I'm obviously in my kitchen. So just one correction, Terry, I own Celesta Restaurant, but I also love Cafe Mana, so I'm glad that you mentioned it. So just a little history about me. I've been plant-based, this is my 30th year, which I'm really happy to celebrate. I'm 46, so I went plant-based at age, trying to get the right angle so everyone can see me here, at age 16. And it's been quite a journey, something I've been very passionate about since then. And it really was a wonderful tool this year when I had a surprise. Many of you have had this experience where I had a health scare. I went in for a routine colonoscopy and they found a neuroendocrine tumor on my small intestine. And so, no symptoms, feeling great, 46 years old. And so all of a sudden I was thrust into the cancer world and luckily had a really successful surgery in January. And I'm cancer-free, and my oncologist attributed a lot of it to my healthy lifestyle and my longtime commitment to plant-based food. So before I share this recipe with you, just want to also share that what I do now is cater in folks' homes, often elevated dinner parties for a birthday, an anniversary, or friends maybe just want to gather and there aren't really options in restaurants that appeal to them. So I can do oil-free, vegetable-focused, I can do different international cuisine. So just reach out to me if you have interest in that. And let's get on with the important part, the recipe. So I'm going to see if I can share my screen really quickly. Maybe not. If not, it's okay, Terry.
Whoop, hold on for just a second. I forgot to
Sure.
catch up as a
I was just
host here.
going to show folks the recipe, and if you would like, feel free to snap a picture with your phone if it is next to you, or let me see if I can share it here. Here we go.
It's coming
Can
up.
you see the image of the recipe?
Yes.
Great. Let's see if I can make it a little smaller. So feel free if it appeals to you to snap a picture, or when I'm done with just a 5 to 8 minute demonstration, feel free to put your name and email address in the chat and I will email you a PDF. So I'll just give 3 or 4 more seconds here if you want to snap a picture. So this is a great recipe. I'm really passionate about replacing refined, and I'm going to stop my share here, refined sugar desserts with healthy alternatives. So I would love to share a really quick sweet potato based dessert with you, and it's a brownie dip. So it only has 4 ingredients. The first ingredient is, of course, a roasted sweet potato. This is so funny on Zoom, by the way. It's really funny to do on Zoom. I'm so used to doing cooking classes in person. And the next ingredient is natural peanut butter. Make sure you get one without added oil or other preservatives. Next is cocoa powder. And lastly is maple syrup. And you can adjust the amount based on your nutrition needs sugar-wise with the maple syrup. So all you do is you can mix this in a bowl, but what I found is that it will still maintain little flecks of sweet potato. And we eat with our eyes. So it's really nice to have a nice homogeneous dip. So I roasted the sweet potato last night. So all you do is, cut down the middle. You can peel the skin right off and just pop it in a food processor or a blender. The other nice thing about using the food processor is it kind of whips it, which makes for a really nice texture. So this is, it says on the recipe, but this is a cup of sweet potato. So I'm just going to put it right in my food processor. And then maybe you can see it, maybe you can't. I'm just going to tilt my screen down a little more so you can see my workspace. There you go. Hopefully that's okay for everyone. So I have my cup of sweet potato, cooked sweet potato. I just roasted it in my toaster oven right here in my food processor. Next, I'm going to do half a cup of natural peanut butter. And I'm not going to use a measuring cup. I rarely do, but you can definitely use a measuring cup. So putting in my half a cup of natural peanut butter. I have not tried this with other nut butters, but I'd be curious how it would be with like an almond butter or something. Okay, next is my cocoa powder. So we're at 3 of 4. We're just gonna do a 1/4 cup. Putting it right here in the food processor. And then lastly is our maple syrup. Obviously, not the fake stuff, the real stuff made here in Wisconsin. And the recipe calls for 4 tablespoons. You can use less. This recipe is 4 servings. So each serving has about a tablespoon of maple syrup, but again, feel free to reduce that. That is it, folks. So I'm going to put my food processor on. Go ahead and cover your ears if you need to. See how we're doing. Let's give it a little scrape and one more go. You can add a little water if you want it to be thinner. And it looks like that did just fine. So I'm going to tilt my screen up a little more and share with you some ways you can enjoy this healthy dessert. So one thing you can do is make a parfait out of it and layer the sweet potato brownie batter dip with unsweetened yogurt. Put granola or fruit on top. You can do what I'm going to do. I'm using a little scooper here and scooping it in a bowl. So this is 2 ounces. So I have 4 little scoops here. I don't know if you can see it. And so I like, instead of having ice cream for dessert, I'll have this. And then I have a bunch of really fun toppings I like to add on top. So here is toasted unsweetened coconut flakes, walnuts, so healthy and nice and crunchy, some fresh fruit. I love strawberries because I like a little sour with the sweet potato. And then this is blueberry chia jam. So I just took a cup of blueberries and mixed them with a tablespoon of chia seeds. That's it. And it makes like a thick jam. And I can put these on top of my base. So here's a sprinkle of the, this is so funny on Zoom, sprinkle of my coconut flakes. And then here's my walnuts. Here are my strawberries. And then lastly, a little scoop of blueberry chia pudding on top. And there you have it, a Whole Foods dessert. So if you're ever looking for a healthy dessert or someone to host a party for you who can offer some really healthy choices, feel free to reach out. And again, feel free to put your email address in the chat if you want me to email you the PDF of the recipe. Terry, any questions for me?
Who's going to eat all of that?
What was that?
Who's going to eat all of that?
I know. Luckily, it's 4 servings, so I can have a little tonight and then over the weekend.
Oh, that looks great. And it takes almost no time to do. I mean, other than a sweet potato the night before.
Yeah, and you can freeze it too. So if you are really watching your intake of sugar or something like that, you can make a big mound of fruit and just put a little scoop of this on top of that if you want to kind of reverse it. That's a nice approach as well.
That is yummy. Well, thank you so much, Melanie.
My pleasure. It was so nice to see all of your smiling faces, and I hope to see you around too. Some of you are quite familiar and some of you are new, but thank you so much for your time. It's made with orange sweet potato, Kathy. But you could try white. That would be nice too. I'd be curious to see how that went. Thank you. I'll take myself off audio now, and I'm really looking forward to the presentations for the remainder of the evening. Thank you so much, Terry.
Thanks, Melanie. Our featured speaker tonight is a non-invasive cardiologist specializing in preventive cardiology and cardiac imaging for Froedtert Medical College of Wisconsin, locally here in Mequon and in West Bend. She focuses on preventive cardiovascular medicine, but takes a holistic approach to patient care, integrating not only traditional medical care, but healthy lifestyle medicine interventions as well, including plant-based nutrition. Tonight, she'll begin by talking to us about how she became interested in plant-based nutrition and lifestyle medicine and how they've affected her and her family. And then follow with a presentation on lifestyle medicine, of which plant-based nutrition is one of the primary pillars. And then some stories about how embracing lifestyle medicine's lifestyle changes have affected some of her patients. She'll be available for Q&A afterwards. So certainly, if you have any questions, you can pop them into the chat, and then we can have them ready when we get to Q&A. I'm so happy to welcome our featured speaker tonight, Dr. Aimee Welsh. Dr. Welsh?
Well, thank you for inviting me to speak tonight to the group. This is a topic that I feel a lot of passion for, and not only in my personal life, but in my medical practice now. So just to start off by talking about sort of my journey to plant-based nutrition and to lifestyle medicine. As Terry mentioned, I'm a board certified non-invasive cardiologist. I did my cardiology fellowship here in Milwaukee at the medical college, starting back in 2009. And after I graduated from fellowship, I was hired and stayed on as staff. And I co-founded and co-directed the preventive cardiology program at MCW and Froedtert Hospital pretty quickly. In 2014, I started doing that with a colleague of mine who was also trained in preventive cardiology. And that was mostly focused on really advanced lipid management, mostly with pharmaceutical medications, with less an emphasis on healthy lifestyle behavior education, although we did talk about nutrition kind of in a very broad context of a Mediterranean style diet. Over the first 8 years that I was practicing in my general practice, as well as in my lipid clinic, I became increasingly frustrated with the lack of improvement in my patients' health. And in fact, it really just seemed that everyone was declining, maybe at a slower rate over time, with me ordering more medications and repeat testing and procedures for people. And at about year 8, I just kind of started thinking to myself, I don't know how I'm going to do this for the rest of my career, because I felt like I wasn't really helping patients very much, and in certain cases, making them at the very least feel worse. Around the same time in my personal life, I've been a lifelong athlete since I was a kid. I played college soccer Division III, and it was always athletic even after college, doing triathlons and staying fit. And around the same time that I started getting frustrated at work, I was doing CrossFit, and I had a back injury, and that was the first major injury I had really had, which kind of threw me into a tailspin of anxiety and not being able to exercise for a while, with some weight gain. And I started to change my diet by actually tracking what I was eating, and sort of that was the first sort of wow moment for me that, God, your diet's really not all that healthy. I was never one to be eating fast food or sweets, but love cheese and, love bread and butter and all sorts of stuff. So that was the first eye-opening moment to me when I actually started tracking my food. And I started making changes towards a whole food plant-based diet, although that wasn't in my mindset at the time. Until about 2019, 2018, actually. I had a colleague who came to see me in my prevention clinic, who was worried about his own risk of heart disease. And he had kind of been researching things on his own and found out about a plant-based diet. And he switched his diet before he even came and saw me. And he actually fixed himself before he even came to see me, losing 20 pounds, cutting his cholesterol in half, getting his blood pressure back into normal ranges, and improving his cardiovascular fitness. And so he was very pumped up and excited to share his success story with me. And then he said to me, "Well, what diet do you eat?" And I said, I eat a pretty healthy diet, mostly vegetables and fruits and grains, but I'd still eat chicken and yogurt and things like that. And he said, "Oh, no, you got to stop eating that way." He said, "You've got to go plant-based. Like, promise me you'll go plant-based, like full in, and just see how you feel." So I said, "Okay, I'll start looking into it and I'll do it." So I ended up reading several papers and books, the first being the China study by T. Colin Campbell. And I just remember like feeling like my whole world was turned upside down. And I immediately adopted a whole food plant-based diet, changed my family's diet. I had my kids at the time were 5 and 10, two boys, and my husband. After I told him about the book and all the research behind this type of dietary eating pattern, he agreed that we all needed to change our diet. So as a family, we adopted a plant-based diet. And my husband at the time was also a lifelong athlete. And the two of us immediately noticed that there seemed to be no ceiling to our fitness level, dramatically increased. We quickly noticed that our muscles recovered better. We were getting fewer viral illnesses from our kids, our young children who were in school, who were always coming home with something. And really just like embrace this lifestyle. And we were very, very fortunate that our families and our friends, who we would see very often for dinner, also kind of embraced our choices and made plant-based meals when we were with them. So it was a fairly easy switch for us. And I do feel very blessed for all of that. So I naturally started changing my medical practice because there was no way I couldn't share this information with my patients. And I started to really counsel patients at every visit to try to make changes. And people who were really in more desperate situations, who were declining, not responding to medication, I urged to try to make big changes quickly and see how they did. And I started to see a lot of success and a lot of patient satisfaction go up with that approach. So in 2020, I decided to actually get certified in plant-based nutrition, taking T. Colin Campbell's eCornell course. And then later that year, I ended up taking my getting board certified in lifestyle medicine. So since that time, I practice, I hate to use the word integrative approach because integrative medicine means something different, but a holistic approach where I still use allopathic medicine, of course, for patients who need medications and need cardiac testing and all of that. But I really take a more holistic approach using the 6 pillars of lifestyle medicine, including plant-based nutrition, to approach my individual patients. And meet them where they are and try to figure out what their actual medical goals or healthcare goals are and see how far we can get with lifestyle medicine. And I find this approach works very, very well for patients. They're usually motivated by avoiding or de-escalating medications, improving how they feel, and away we go. So that's kind of my story there. These are some of just my personal benefits that I noticed pretty quickly after adopting a whole food plant-based diet. My cholesterol was never high to begin with, but it dropped an additional 10 milligrams per deciliter. I was never pre-diabetic or diabetic, but I saw my glycohemoglobin improve. as I mentioned before, my fitness and muscle recovery improved. I had improved GI distress that I had been experiencing my whole life and didn't even realize was an issue. Improved joint pain. So overall, I never felt bad, but I felt so much better than my baseline on adopting this lifestyle. So I wanted to take the rest of the time to talk to you about how I use lifestyle medicine in my preventive cardiology practice, focusing a bit on whole food plant-based diet a little bit more than the other 6 pillars of lifestyle medicine. So we'll talk about that first, then we'll go over the 6 pillars of lifestyle medicine and then how I incorporate that into my clinical practice. And then I'll share with you 2 success stories that I've had with patients. So I think most people, probably not people in this group, but most of the general population don't realize that the food we eat has the most impact on our health and well-being, even more so than our genetics. And there's a whole study of epigenetics, which talks about how our genes are turned on and off based on our behaviors and our environment, and nutrition is a key one of those factors there. So really, I just wanted to talk about what do we mean by nutrition? What is actually food? Because nutrition is quite complex. It's the complex biochemical and physiologic processes or reactions in the human body that are supported with food. Food meaning substances made up of macronutrients, so generally carbohydrates, fats, proteins, and fiber, as well as vitamins, minerals, other micronutrients that really are there to provide our energy, provide our body with energy, stimulate appropriate growth and repair, and support our vital bodily functions to maintain our life. So what is a healthy diet then? Because there's a lot of noise in this space about what is a healthful diet here. And this slide is just to kind of show you, like, it's confusing, right? Like one day they're telling you not to eat eggs and butter, the next they're saying butter's back. We've all been told that chicken is a healthful meat to eat, but really we've done some research showing that's not necessarily the case. So there's a lot of noise and a lot of confusion. And after a while, a lot of people just kind of throw their hands up and say, well, I'm just going to eat what tastes good to me. And we end up right back where we started. When we look at the top 10 causes of death associated and their associated risk factors, and this is mirrored actually globally. I don't have that slide up here, but when we look at the top causes of death for both men and women in the United States, so chronic ischemic heart disease, generally coronary artery disease, cognitive impairment and dementia, even lung disease, lung cancer, COPD, other cancers, breast cancer, diabetes, these types of things. Poor diet is the #1 risk factor for 7 out of these top 10 causes of death, premature death in the United States as well as globally. That is quite striking. I mean, that is more causal than smoking, hypertension alone, obesity alone. So this is a really important part of our overall health and well-being that we're really, really struggling with the current food environment that we live in. So when we look at a standard American diet here on the right-hand side versus a whole food plant-based diet, what's really most striking is that the majority of Americans get the majority of their daily calories from ultra-processed foods. So over 60% of calories people are ingesting from ultra-processed foods. And anyone who's been in a grocery store in the United States probably wouldn't be terribly surprised by that, because most of it is filled with ultra-processed foods. Everything that is, for the most part, shelf stable in a bag that no mold or bacteria or anything will grow on for months at a time without being refrigerated. That has 30 different ingredients that you can't pronounce the name of, really qualifies as an ultra-processed food. Beyond the ultra-processed food, the second largest types of foods people are consuming are coming from animal products. So 25 to 30% of calories coming from meats, dairy, eggs, and whatnot. And then very, very little is coming from whole plant foods. So 6% or less. Another 6% comes from processed plant foods. So you can think of all the soy fillers, corn fillers, and things like that in the ultra processed food. So very little is coming from whole plant foods. A recent study that was published looked at how much fruit consumption children in the United States have, and less than 50% of kids now in the United States are eating any fruit. I find this to be an extremely alarming statistic, as if they're not eating fruit, then there's no way they're eating any kind of vegetables. So things seem to be progressing kind of in the wrong direction in general in our culture. So in general, all this processed food is high in sugar and added preservatives, high in saturated fat, high in salt, and then really very deficient in fiber, very deficient in micro and phytonutrients, and low in water. And overall, I think of the standard American diet really as a pro-inflammatory diet. It promotes chronic disease through inflammation and cellular aging. In contrast, we have a whole food plant-based diet where we're talking about large amounts of vegetables, whole grains in their minimally processed form, so not a bunch of grains that were pulverized into a flour to make chips and crackers and baked goods and things like that, but whole grains like oats, quinoa, millet, buckwheat, bulgur. There's many, many of them out there. Fruits, legumes and beans, chickpeas, peas, lentils, any kinds of beans, nuts and seeds, and then of course water. So this diet is high in fiber, high in antioxidants, high in phytonutrients, has higher water content, low saturated fat, no dietary cholesterol that's only found in animal products, and generally low in salt. And I think about this as an anti-inflammatory diet that allows our body and our immune system to calm down so that it promotes healing and health. So in terms of what do we mean by a whole food plant-based diet, does this mean a vegan diet? Does this mean a pescatarian diet? So I kind of think of a plant-based diet on a spectrum when I'm talking to patients, because I recognized early on when I really started trying to push people towards a exclusively whole plant-based diet, whole food plant-based diet, or healthy vegan diet, I was met with less success than when I was able to kind of meet people where they are and actually look at their individual nutritional needs. But in general, a plant-based diet is excluding meat and poultry, it's excluding seafood, it's excluding eggs and all dairy products. In terms of oils, trying to minimize those, but it doesn't necessarily exclude those. Minimize processed foods as much as possible. And then again, really focus on those whole grains, fruits, veggies, beans and legumes, nuts and seeds. So plant-based versus plant-based, right? So what we're talking about, the keyword being, or the keywords being whole food plant-based, because you can eat a very highly processed plant-based or vegan diet that is very, very unhealthful and arguably less healthful than even the standard American diet. So they make all sorts of vegan macaroni and cheese and cookies and crackers. Oreos are vegan. So on the left-hand side of the screen here, the only good thing on that plate, I would argue, is the broccoli, compared to a true whole food plant-based diet where we've got quinoa and sweet potato and avocado and lots of non-starchy vegetables and some nuts and beans. So they are very, very different diets, and it's really important to emphasize that to my patients when we get started down this path. So when we look at disease and whole plant food consumption globally, this is old data from the late 1990s here, but the red is percentage of deaths from heart disease and cancer, and the purple is the percentage of calories in general eaten by the populations in these countries from whole plant foods. And you can see this indirect correlation. So as the amount of plant foods goes up, you see the percentage of deaths from heart disease and cancer go down quite dramatically. So this is looking at some population level data promoting sort of the benefits of an unrefined whole plant food pattern of eating. So if we look at individual risk factors for cardiovascular disease, and we look at whole food plant-based diet, so I'm just going to go through some big risk factors quickly here, which generally is high cholesterol or dyslipidemia, high blood pressure, diabetes, and just show you some slides kind of arguing or proving that really eating a whole food plant-based diet pattern of eating is has shown to be helpful for reducing these risk factors. So in this figure here, it's looking at specific foods or groups of foods that modify our LDL cholesterol, which is the cholesterol carried by the small particles that get into the arterial wall and is now agreed upon to be causal of atherosclerosis or plaque formation in our arteries, which is what puts us at risk of heart attack and stroke. And when you look here, down towards the green arrow means beneficial in terms of reducing LDL or bad cholesterol, that primary driver of plaque formation. And the food substances that do the opposite of that are going up here across sort of our zero line, our null line towards the negative end of that. So when we look here, we see all of our good whole plant foods that we talk about. We see our whole grains here, we see our seeds here, our nuts, our legumes and beans, unsaturated vegetable oils, so things like olive oil, avocado, some spices, anti-inflammatory spices like turmeric, green tea, tomatoes, and whatnot. And some things I think that people would be surprised by is that fish is kind of neutral in terms of our cholesterol, and it really depends what type of fish that you're eating. So if you're eating high omega-3 fatty fish, that seems to provide benefit, whereas some of the other fish, like certain types of shellfish, like shrimp or lobster, which are high in dietary cholesterol, without the omega-3s probably would be on the more harmful side. When we look at solid fats that we typically find in our meats and cheeses, butter, ghee, clearly not helpful. Processed sugar, which does not have fat in it, but just the processed sugar actually pushes our bad cholesterol in a poor direction. So when the whole non-fat fad came into place, what did they replace some of the fat with sugar, and actually it made things worse for people, made them less healthy. So one not surprising to me, but unfiltered coffee, when you don't use a filter, actually all the oils and fats that are unhealthy that are naturally occurring in the coffee bean get into what you're drinking, and that actually I've seen in several patients drive up their LDL cholesterol over time. So this is just a more comprehensive list on the side I put in here for reference to you, with the scientific evidence showing how it modifies our LDL cholesterol. And the far column here is sort of the grading of the level of evidence as being low evidence, moderately good evidence versus very good evidence in the high category there. So looking at high blood pressure, hypertension here, this is, I know, very medically oriented, but just looking mechanistically at what happens to us when we are eating a standard American diet, highly processed, fast food type diet, compared to a more Mediterranean or whole food plant-based diet here. What happens to our body as we start to store fat in bad places, and how that affects our blood vessels, leading to hypertension here. And the various effects it has not only on our blood vessels in our heart, but also in our kidneys, in our brain, leading to chronic kidney disease, leading to cognitive decline over time. So, so this has been looked at mechanistically in good scientific studies, all showing that a more whole food plant-based diet significantly reduces high blood pressure and all the downstream poor consequences for our health. And this is really also has been shown in the DASH diet trial. Most people are familiar with the DASH diet as being a low sodium diet. I didn't include that slide here, but that trial design was actually supposed to be a vegan or vegetarian diet, and they ended up changing it because they were afraid they wouldn't be able to recruit or retain people in the study. So they changed the diet from a vegetarian vegan diet to a diet that just emphasized whole grains, eating unsaturated, more healthful plant fats, And when you look at that data, they changed the diet in 2 groups, and then they gave them varying amounts of salt. And the biggest benefit to the drop in blood pressure was in the high salt group, just by adding whole grains, emphasizing vegetables and healthy plant sources of fats. When you added the low sodium on top of that, you got additional benefit. And that's one part of that trial that's really ignored, is that the dietary intervention, which wasn't even dramatic, it was not telling people to go on a vegan diet, led to substantial changes in blood pressure. So this is just looking at diabetes, just talking about, I wanted to emphasize what actually causes diabetes here, because there's great misunderstanding in this realm as well. People are told they're pre-diabetic or diabetic and not to eat carbohydrates. Well, the carbohydrates, and even if you were eating sugar, is not what causes insulin resistance leading to diabetes. It is caused by overeating calories, so a calorie surplus over time, as well as eating high saturated fat diets, generally coming from animal products. When those 2 things occur, we start depositing fat in our liver, our pancreas, our skeletal muscle, places it's not supposed to be. And that makes us insulin resistant, and we get in this terrible cycle of more insulin resistance, higher blood sugars. And almost every person who ends up becoming pre-diabetic goes on to developing diabetes if they do not make substantial lifestyle changes, which includes moving towards a more low-fat, whole food, plant-based diet. Instead, they're actually told to do the opposite, and they're told to stop eating carbohydrates, including fruits and vegetables. And what do they replace that with? More meat, more dairy, and their insulin resistance actually gets worse over time, requiring more oral medications initially and eventually requiring insulin. So this is something that I talk a lot to my patients who are becoming insulin resistant or already have diabetes, to really hit home that what they're being told for keeping their blood sugar low, yes, if you're not eating carbohydrates, your blood sugar will stay lower, but you are not attacking the root cause of the problem, which is insulin resistance, which we have to tackle by moving towards a more plant-based diet. So just a couple of slides on ultra-processed foods here, really to hit home how harmful these foods are for us, more so even, I think, than the animal products. So this was a large study done looking at overall mortality with ultra-processed food consumption. So for incremental increases in how they were quantifying how much ultra-processed foods people were eating, they saw increased mortality over time. And this was a fairly short follow-up. So to see our mortality divergence is pretty significant. So the yellow dashed line here is eating greater than 3 servings a day of ultra-processed foods. And the purple line here on the left is less than 3 servings a day. And you can see how those curves diverge with increased mortality on the yellow curve. On the right-hand side here, they're looking at, for each additional serving of ultra-processed foods, what happened to people's increased mortality. So the purple bar is the study group here. The dotted yellow lines are a confidence interval, so showing you that this is statistically significant data here. So as you increase, not surprising to anyone here probably, but as you increased the processed food consumption, even just by 1 serving a day, we saw an increase in all-cause mortality of about 18%. So, so that's usually the first step I take when I approach patients eating a standard American diet. Is I say, let's cut out the processed food first in most cases. So a quick word on animal protein and mortality. It's important to recognize in any nutrition science, it really, what really matters is what you're replacing one food substance with. And so there's varying degrees of benefit of changing the animal protein you're eating. So it's very clear that ultra processed meats and red meats are the worst. And when you replace that even with poultry and dairy, you do see a benefit in terms of reduced cardiovascular risk, reduced mortality for people. When you replace chicken and poultry and fish even with non-fat dairy, you see a benefit. When you replace any animal protein with plant protein, you see the biggest benefit. to people, and that is kind of what the data here is showing, looking at very, very large cohort populations from the Nurses Health Study and the Health Physicians Follow-Up Study. And this was both studies together, over 131,000 patients looking at this with extensive food questionnaires. So what's so amazing about plants? So like I mentioned before, high fiber, high in micronutrients, antioxidants, phytonutrients, generally high in omega-3s and polyunsaturated, monounsaturated fats, high water content, no cholesterol, and generally low in saturated fat. So just looking here, this is a large bowl of lentils. 400 grams is a large bowl, but you can get plenty of protein this way, a lot of calcium, iron, and a lot of fiber, 31 grams of fiber. If you compare that to eating, a piece of steak, you might get the same or similar amount of protein, but you have very minimal nutrients, minerals, and zero fiber being a particularly important distinction between the two. I think I'll just kind of skip over this. This is just kind of getting a little bit into some detail about the benefits of fiber. Bottom line is we're all probably not in this group, but people eating a standard American diet are really very fiber deficient, and no one's talking really to them about this being a key fourth micronutrient that probably we should all be focusing on. So, primitive human beings probably were eating about 100 grams of fiber a day, which is an enormous amount of fiber. People on whole food plant-based diets probably can get up to 50 to 70 grams of fiber depending on their dietary preferences and intolerances. The average American is eating such minimal amounts of fiber, really less than 20 grams of fiber a day, and they're having a lot of GI issues because of this. So fiber is very, very key nutrient to support our gut microbiome, which is we're finding out more and more data about the importance of the gut microbiome for normal metabolism and vitality throughout our entire body. And fiber is the fuel that feeds the healthful gut microbiome, so bacteria in our gut that helps regulate our weight, our hormones, our cholesterol levels, and is really, really a key component to our health. So we want to feed our good gut bacteria, lots of fiber, different sources of fiber, keep that healthy over time to keep our whole body healthy. So some data looking specifically at the cardiovascular effects of a whole food plant-based diet, all of what I've already been talking about. So helping maintain a normal weight, if not weight loss, improve insulin sensitivity, and preventing insulin resistance, improve our LDL cholesterol and our lipid profile in general, reducing our blood pressure, improving the function of the lining of our blood vessels, our endothelium that promotes vascular health, decreasing inflammation in general, which is really the key common factor underlying or underpinning all chronic diseases, and again, improving our gut microbiome all helps keep our cardiovascular system healthy. So I'm going to transition over to lifestyle medicine, which does emphasize a whole food plant-based diet, but we have 5 other pillars that we talk about that are key to longevity and health span for patients, preventing chronic disease or helping to alleviate and possibly even reverse chronic disease. So the other 5 pillars being daily physical activity, consistent, regular, high quality sleep, stress management, positive, healthy relationships, and avoiding risky substances like tobacco and alcohol. So the whole idea behind lifestyle medicine is to really try to address the root cause of chronic disease, which is mostly lifestyle based, as we talked about in the beginning. It's based on strong evidence and research. It is highly effective in terms of producing better outcomes for patients at a much lower financial cost. And it really emphasizes a team-based model where the clinician and the patient are active partners in their health and well-being. So again, we're there to try to address the root cause of disease through these 6 pillars in lifestyle medicine here, compared to conventional or allopathic medicine, which really heavily relies on invasive procedures, as well as pharmaceutical medical management of symptoms. Rather than trying to reverse or address root cause of disease, we're really there for symptomatic relief in many cases. That is our goal with conventional medicine. Then you have integrative medicine, which uses complementary therapies to treat disease. So maybe like acupuncture and things like that, versus functional medicine, where they're using a lot of supplements, so nutraceuticals to kind of address health. And then you have naturopathic medicine, which kind of combines different aspects of integrative and functional medicine as well. So if you look at the guidelines for basically every single cardiovascular disease, as well as almost every other chronic disease, chronic kidney disease, hypertension, even cancer, our professional societies all talk about healthy lifestyle behaviors as a first-line treatment for all these chronic illnesses. Yet clinicians are not spending any time with patients really talking about lifestyle change in any serious or meaningful way, helping patients actually make those changes. They may say, yeah, you need to lose some weight, you need to improve your diet, you need to exercise, and you have to manage your stress better. And that's really where the conversation kind of ends. And of course, our patients are left saying, okay, well, how do I make these changes and make them a lifestyle rather than just a trend that I can do for a couple weeks. So this is something that we all need to be better at, and this is why we have a whole new professional society focusing on lifestyle medicine. So because I already spent a lot of time on plant-based nutrition, I wanted to talk about physical activity and sleep in particular, and I'll try to touch on the other pillars of lifestyle medicine as well. But physical activity I really consider to be equally important to plant-based nutrition for patients. And really, this is our fountain of youth. The real key to longevity is to stay active and to keep moving. If you look at the amount of physical inactivity in our society, even with our kids are becoming less and less active over time, most Americans are sitting for a large majority of the waking hours, so about 11 hours on average between our sedentary jobs and our commuting in cars or trains and things like that. 20% of all deaths of people who are 35 and older can be attributed in a large way to their lack of physical activity. And our decline as we age, for sure, is contributed most strongly to physical inactivity. If you look at what the physical activity recommendations are from the World Health Organization, which actually just bumped up their recommendations, a minimum of 150 minutes a week of moderate intensity, but ideally up to 300 minutes a week. Less than 25% of the population is even meeting the minimum standard of 150 minutes of activity a week. And even for those people who are exercising routinely, they tend to be very sedentary for the rest of the day unless they tend to have active jobs. So the inactivity beyond exercise is also a problem. So, and then of course we have great disparities in people's ability to access exercise space when they are socioeconomically disadvantaged. They also tend to live in communities where they don't have safe places to walk and be active outside. So exercise makes a huge difference in our overall health. Obviously, great benefits for cardiovascular disease. helps to maintain bone strength and muscle strength. So we have less frailty, less sarcopenia as we age, meaning loss of muscle mass, which makes us prone to falls and fractures and imbalance. Significantly lowers our risk of developing type 2 diabetes over our lifetime, does help control our weight. We generally sleep better when we're exercising routinely and are active. Our overall energy levels are improved. This is a huge one, a 30% reduction in your risk of cognitive impairment or dementia. And for women, this is particularly important because we are at higher risk than men for developing cognitive decline and dementia. So exercise is so important. And the biggest benefit that we see really comes in people who are completely sedentary, even doing very small amounts of exercise. We see a huge benefit. This slide here on the left is looking at incremental amounts of physical activity versus lower amounts of physical activity here. So, so moving towards the left favors higher amounts of physical activity, and the different colors are comparing in red high physical activity to low levels of physical activity. So really the more the better, but any amount significantly improves outcomes for patients in terms of reducing cardiovascular disease. And we see this beyond cardiovascular disease in other aspects of health as well. So on the right here, we're looking at leisure time physical activity, so not scheduled exercise. So we call this non-exercise activity, looking how this predicts MACE means major adverse cardiovascular events, so heart attack, stroke, cardiovascular death in a cohort of diabetic patients here, and increasing our leisure time activity to more than 3 times a week. So going on maybe a walk with a friend, things like that. So not necessarily like scheduled exercise time in the gym where you're kind of doing more high intensity exercise, just doing that more than 3 times per week. You saw here we had less cardiovascular events, so more cardiovascular event-free survival on the top here compared to people who were doing no leisure time activity. You can see here how dramatic the difference was, and then having cardiovascular events leading to death. So pretty powerful there. A quick slide on what type of exercise is best. This is looking at aerobic exercise versus resistance training. So RT resistance training, AT aerobic training, both are beneficial in terms of reducing blood pressure, improving lipid profiles, improving insulin sensitivity. It looks like though a combination of the two is really most beneficial. So we get a synergistic effect by adding strength training or resistance training on top of aerobic or cardiovascular type exercise. So this is something that is in the guidelines, telling people to do strength training, 2 to 3 times a week if they can. This is oftentimes very difficult for people if they are not, haven't done strength training before, and really probably requires more of a exercise prescription for people rather than aerobic training, which you can tell people to go for a walk at a moderate pace pretty easily. But trying to give them a prescription of how to start doing resistance training is a little bit more tricky. But when we tell our patients to exercise, it's best to give them a very specific prescription, write it down for them, what you exactly want them doing and for what duration. And patients are not necessarily going to be able to do, 60 minutes a day of aerobic training right off the bat. So meeting people where they're at, if they're completely sedentary, asking them to do a 10-minute walk or even a 5-minute walk a day, but do it 2 or 3 times a day to get them going. So this has to be really tailored to the individual's level of activity, their prior sort of athleticism, and to get people to that ultimate goal of where we want them to be, which is doing that at least 150 minutes of moderate aerobic activity plus some strength training on top of that. So this is kind of what a prescription would look like for resistance training, low intensity, looking at reps and things like that. That's I just put up here as an example if there's any clinicians out there that they could use to help with that. Oftentimes I'm showing people how to do some, my older patients, how to do some, assisted body weight movements in the office. I wish I had more time and actually had an exercise physiologist that worked with me that I could kind of pass them off to and really sit down with patients, and maybe one day I'll have a comprehensive space where I could do that, but that would be ideal, getting everyone working with an exercise physiologist a couple times and creating a very personalized program for them to move forward. If my patients have financial resources, access to a gym with personal trainers and things like that, I do recommend that they get a personal trainer to help them with a resistance training program, because I don't want my patients to get hurt. Avoiding injury is very, very important with the resistance training piece. So on to restorative sleep. This is another key pillar. I put this right underneath the importance of plant-based nutrition and exercise is restorative sleep. Most Americans are chronically sleep deprived, and it is significantly leading to decreased health and increased disease for people. Sleep is so important, one, for a cleansing of our brain. It's when our brain flushes out the toxins that have accumulated. It's important for our overall metabolic health, including maintaining a normal weight. It's important for our cognitive function, our attention. It's important for insulin resistance. So really focusing on telling people they need to allow for a 7 to 9 hour window of sleep with consistent bedtimes, consistent wake times, and good sleep hygiene, which generally means sleeping in a cool place that's dark, avoiding a lot of blue light before bed. So trying to get your cell phone, your smartphone out of your bedroom is something I struggle with as well, is really a key there. Getting our body to calm with less bright lights. And then really trying to get outdoors early in the morning. So soon after you wake up, our circadian rhythm is mostly regulated by light, also by food. So getting out into natural light first thing in the morning, if you can, even if it's just 10 minutes sitting on the porch, having your cup of tea or cup of coffee. And also then trying to be out as the sun is setting is the other key piece of the natural light. Most of us are inside for most of the day at our jobs, but if you can get out just for short periods of time with sunrise and sunset, that would be helpful to resetting your circadian rhythm. And the other is really not eating late at night. So I try not to have my patients eating certainly after 8 p.m., but if they could stop eating by 7 p.m. To get their circadian rhythm back in shape when they're having a lot of difficulty with sleep. So again, this is just more on why we sleep and how sleep deprivation is really so detrimental to our overall health. On to stress management. So stress management is so important. I can't tell you the amount of anxiety that underlies a lot of symptoms people are feeling and disease processes going on for them. And this is hard. And so when I talk to my patients, I really talk to them about creating what I call a self-care routine. So it's easy to just say, do some yoga, do some meditation. Those things are very hard for people to implement without, again, having a specific plan in place and having the time to do it. And so we talk a lot about, well, what time do people have in their day for stress management? What times of day would optimize that for people? So generally for me, first thing in the morning, right before bed, and talking, can we do 2 minutes of deep breathing work? Can you do 5 minutes of sitting there and meditating if that's something that interests you and you feel like you can do? Can we do stretching, gentle stretching, and incorporate deep breathing into that? I talk a lot about journaling for stress relief. I talk a lot about keeping a gratitude journal, whether that's you writing it down. I do mine with my friends through a group text that we have going on every morning. I send them my 5 things I'm grateful for when I wake up that morning. And I don't care if anyone replies back or not, but I told them keep doing it. So, so there's different strategies that you can do. And all these little things, when we add them together, really make a big impact, but they have to become part of your self-care routine because they do make you feel better, and you don't notice that how much they're working until you stop doing it. So I focus a lot on that with my stress management. Social connection. So humans are social creatures. We wouldn't survive in isolation. It's very harmful to our physical and mental health to feel isolated. And this is something that, our current Surgeon General, Vivek Murthy, talks about a lot because he, through his job and talking to so many people in various groups around the United States, really hit on a key fact that people are feeling very isolated and very alone. And it's not people who live alone necessarily. And the importance of positive social connection and being with our friends and family in meaningful ways. And leveraging the power of these relationships for our overall health and reinforcement of all those other healthy behaviors. So really, it affects our mental health and our outlook on life, our ability to manage stress, have resilience is directly related to our social connections. Our biology is affected by it. So stress hormone levels like cortisol go up when we're feeling isolated. And then we're less motivated to engage in all those other physical, other behaviors of healthy lifestyle, like good nutrition, physical activity, focusing on our sleep. So social connection is really a key component there. And it's something that requires time. And I know we all feel time crunched, but it's really saying, do I really need to fold that laundry right now? Or can I take that time and like call a friend? Or can I take that time and really just focus on spending quality time with my friends or calling up my parents, making time to share a meal with family and friends. It's also important. So figuring out ways to incorporate that into our lifestyle is so important. When you look at how many people, when Dr. Murthy has done some of these studies looking about how many people in surveys feel lonely and feel isolated, 1 in 3 adults, which is a huge number of people who are feeling isolated out there. And then in terms of lack of social or emotional support, about 25% of adults in the United States. So these are really alarming statistics. And if anyone is familiar with the blue zones, which are these pocket regions throughout the globe where people tend to have less chronic disease and live longer, more healthful lives into their 90s and even hundreds. One of the key sort of commonalities between those very different demographics is that they all have strong social connections. So still living in intergenerational homes, small communities, where people work and live together quite closely is a commonality there. So it is such an important part of our overall health. So I think I'll stop there. Do you want me to go on, Terry, to the 2 patient kind of examples I have, or do you want me to take questions?
Yeah, I'd really appreciate hearing the patient examples. Those are always
Sure.
one of my favorites. And then we do have a lot of questions in the chat box, and I know Josh is here too to finish off. So if we can maybe with questions take it up to, why don't you go ahead with the patient examples?
Okay, sure. I can run through these pretty quick. 2 different types of patients that I saw. So first I'll present Mickey. She's a 74-year-old woman. She came to me for a preoperative evaluation before she had a knee replacement. She had a history of high blood pressure, prediabetes. A left bundle branch block is an electrical abnormality with the conduction system of her heart. Otherwise, no heart history. But when I was talking to her, she told me, I've been having like chest tightness when I exercise and more shortness of breath for a year. I told my doctor about it and they said, oh, it's nothing. Probably some reflux. And And I said, well, that sounds very concerning to me, like angina, chest pain happening when the heart muscle is not getting adequate blood flow. So I sent her for a stress test. This is looking at some of her numbers here. I'll just point out her bad cholesterol was 114 milligrams per deciliter, which is a little less than average, but about average. And nothing really else was standing out other than her glycohemoglobin was in that prediabetes range. Otherwise, her blood pressure was well controlled. Kidney function looked pretty normal. So I sent her for a stress test, which was abnormal. So then I sent her for a heart catheterization or coronary angiography. So that's where we inject X-ray dye down the heart arteries and take X-ray pictures. And the red circles here are pointing out that she had severe narrowing of her left anterior descending artery. This artery supplies a very large part of our heart muscle with blood. People call it the widowmaker. Any of them can be widowmakers if they become occluded, but so she had very tight blockage in the left anterior descending, and she also had a tight blockage in the far left panel here in the right coronary artery. So two of the three major coronary arteries had significant and severe blockage. So she ended up getting a bypass surgery before she had her knee replaced. And after that, I had her on the optimal medical therapy. So GDMT means our guideline directed or goal directed medical therapy with aspirin and some other drugs, including a high dose statin or cholesterol lowering medication. I sent her to cardiac rehab, which she completed. I got her bad cholesterol from 114 down to 40 milligrams per deciliter. Her blood pressure was controlled. I saw her every 6 months. She was trying to exercise. And 2 years later, she came in having an acute heart attack. I sent her back to the cath lab, and this time that third artery, which previously had been open, so on my bottom panel here, this is the old angiogram from 2 years prior. You can see this blood vessel here was opened, and now here it was completely occluded, which caused her heart attack. And because of this heart attack, she ended up having heart muscle damage, and her heart muscle became mildly weakened and it never recovered. And then she started to develop some congestive heart failure symptoms after that. And I just felt this was one of my favorite patients, and I felt like I had failed her. I looked back and I said, God, I did all the things I'm supposed to do for her from, a cardiology conventional perspective. I had her on all the right drugs. I got her to the target levels for cholesterol and blood pressure and all these things. And yet 2 years later, she came back with a heart attack. And I felt very sad and disappointed in myself about that. And so I sat down with her and I said, we did all the things and you still had this happen to you. And now we really need to focus on the lifestyle stuff. And so I got her, she grew up in the South, so it was challenging to get her to move towards a plant-based diet, but we made slow gains on that front. And she suffered greatly from the climate here. She had seasonal affective disorder. And ultimately, when she brought up potentially moving back to the South to a warmer climate, I highly encouraged her to do that. Plus, she would be closer to family. So she made that change and she started exercising routinely and maintained that lifestyle. Her chest pain and heart failure symptoms resolved. Her, because I hear from her from time to time, her mood has improved. She's finally lost a little bit of weight and she hasn't been hospitalized again now 5 years later with a recurrent heart attack or congestive heart failure. So even though she's moved away and I don't take care of her anymore, it was the lifestyle changes that we made for her that seemed to have really benefited her greatly and more so than my conventional medical therapy, that I had initially worked hard to get her to her targets. So that's Mickey's story. Next is Larry, another one of my favorite patients. 72-year-old man I had followed for many years, very overweight, class 3 obesity, so BMI greater than 40, high blood pressure, diabetes, sleep apnea, kidney disease, all the things that we see with chronic metabolic dysfunction. I call it total body metabolic failure that's affecting basically every organ. And HFpEF stands for heart failure with a normally squeezing heart or preserved ejection fraction. So Larry was in and out of the hospital all the time with congestive heart failure exacerbations, where he would accumulate all this fluid and his kidney function would get worse, and we'd have to give him high doses of intravenous diuretics to get all the fluid off of him. And every time I saw him as an outpatient, I'm just escalating the polypharmacy I had him on. And eventually he became resistant to these high doses of diuretics and was getting hospitalized quite frequently. And his kidney function was continuing to decline and decline. His diabetes was becoming more poorly controlled over time. And so his wife finally at this kind of critical visit said to me, like looked at me in confusion and said to me, well, how is he doing? And I said, he's doing horribly. You know, he's just getting worse and worse over time. And she said, well, what else can we do? And I said to her, well, this is what you can do, but you have to do it quickly. And so I told them they needed to adopt a whole food plant-based diet and really try to dive headfirst in getting at least 75% of their calories coming from whole plant foods. I met with them on a weekly basis. This was right before everything shut down with COVID. And then I met with them on Zoom quite frequently, and they had a lot of trouble moving towards a healthy vegan or vegetarian diet. They did it. It ended up with them eating a lot of food that they thought tasted bad, that they were trying to make these complicated vegan type recipes. So with a lot of tweaking, going back to basics, they were able to get themselves on vegetarian diet. He lost 6 pounds in a week. Ultimately, he ended up losing 30 pounds in 6 months. But it was a real struggle in the beginning. I moved to Maine in 2020 and was there for 2 years. So I wasn't there anymore, but they kept at it and they would send me notes. And in December of 2020, I got a Christmas card and a gift from Larry and his wife that he had actually lost 60 pounds. Was still eating a vegetarian diet. He was walking 30 minutes a day when he couldn't walk more than really 20 feet before. And his kidney function, creatinine is a marker of your kidney function, normal being around 1, had gone from 3.8, which was moving towards ending up on dialysis, down to 1.8. So we were able to significantly reverse or improve his chronic kidney disease, which is really not thought of conventionally as being a reversible problem. His swelling improved, and most importantly, he stayed out of the hospital. So I still see Larry. He rejoined my practice after I moved back to Wisconsin, and he continues to do well. So, and I'll stop there.
That's outstanding. Well, thank you for the excellent information, Dr. Welsh. And we've got a bunch of questions here, so I'm going to try and go through these as quickly as possible. We may not get to Dr. Lieberman. We'll try to get to as many questions as we can here. So starting at the beginning, Grace says, when you talk about preventive cardiology, does a whole food plant-based diet impact those with heart failure?
Yeah, it does. There is data, I think, that Dr. Dean Ornish has published looking at heart failure patients, certainly in terms of improving their symptoms and recurrent hospitalizations. But he has actually some data in people with congestive heart failure with reduced ejection fraction, so weakened muscles, that we see improvement in the function of their ventricle, of the main pump of their heart. So that data is out there. And certainly they also qualify for cardiac rehab, which our cardiac rehab is part of the Pritikin program, which is, it's not a whole food plant-based diet, but Nathan Pritikin was kind of a pioneer looking at that. And so we get patients eating a more plant-based diet, our heart failure patients who enroll in that program.
Right.
The second important thing just about heart failure is a huge benefit from exercise to these patients as well. So just incorporating the other lifestyle medicine big pillar.
And just an aside, if I remember correctly, I think Nathan Pritikin, I think Dr. Greger's mother went to Nathan Pritikin, and that's
That's correct. Yeah.
her grandmother. And that was what turned him on to whole food plant-based in the first place.
That's right. He credits Nathan Pritikin with saving his grandmother's life. Yeah.
Mary says, or mentions, if there's time for questions, please comment on osteopenia, osteoporosis, and if plant-based can be sufficient for bones without dairy. And I think you talked about this a little bit, but
Yeah, so there are many plant-based calcium-rich foods, green leafy vegetables, beans and legumes. If you are drinking plant-based milks, they're all fortified with calcium. Tofu is a great source of calcium. So there shouldn't be a problem with getting enough calcium in a whole food plant-based diet, so that you could easily eliminate dairy and not have to worry about the calcium intake there.
Anne Marie mentions, can you make suggestions to reduce triglycerides? She said that she's been eating only plant-based, but in 1 year triglycerides went from 186 to 305.
Yeah, so so triglycerides really, if they're going up, you really need to take a close look at the amount of fats that you're eating in the diet. And it may be that you need to start reducing some of the total fat in your diet. When we see people with severely elevated triglycerides, we really want them on an extremely low fat diet. So in the plant-based world, that would be the equivalent of an Esselstyn diet, where you're really excluding all oils, really excluding avocado and nuts and seeds to try to get your fat content down to less than 20% of calories coming from fat. It's pretty extreme to do that. So you kind of have to look at how much fat you were consuming, because plant foods do have saturated fat in them as well. So, you know, if you're consuming a lot of olive oil and certain types of nuts, you may be consuming a lot more fat than you realize. So I would recommend tracking what you're eating on an app like MyFitnessPal. You'll have to weigh your food and enter that, and you can just probably do that for 3 to 5 days, and then it will break it down to you and show you how much saturated fat you're eating and what the sources of that are, and total fat as well.
Let's see. Mary asks, can we have a copy of the slides? We are going to be posting this, Mary, so you will be able to pull the whole presentation up, but that won't be a slide deck. Karen said, what's the best way to reduce LDL cholesterol without medication? And then she put a whole food plant-based question mark. And I think you answered that pretty well, but if you want to spend 10 seconds on that.
Sure. So what I will say about this is that it depends on the individual, because cholesterol metabolism and transport is very complicated. And it involves not only the cholesterol, the fats and cholesterol you're eating is one component to it, but it also depends on how much you're excreting through the liver, which is generally determined by genetics, and how well you absorb or don't absorb cholesterol back into the intestinal system. On average, I will tell you, my patients who make substantial changes and get themselves 75+% plant-based generally see at least a 25% reduction in their LDL cholesterol. I have some people who are hyper responders, where we see like 65% reductions in their LDL cholesterol just with changing to a plant-based diet. But those people are more the exception than the general rule. And my guess is that those patients who are these hyper responders are hyper absorbers of cholesterol, actually. So the dietary component, changing that really dramatically drops their bad cholesterol. I have other patients where they don't see a big drop and they're trying really hard. And they probably just are not excreting bad cholesterol well. and changes in the diet are not going to alter that very much, quite frankly. So unless people are eating a ton of saturated fat and eliminate that, they'll see a bump, but they're not going to see a 60% or 50% reduction. And then they really need to see either someone like me to give them a more comprehensive risk assessment to figure out, do they need to be on cholesterol lowering medication?
Thank you. Colette responded to Mary and gave a great story about her personal situation where she had, I think, osteopenia, or the bone density was going down. She mentioned she's 79 next month, but I think the end of it, it said, I have no medical, that I was retired so I can increase my exercise and I'm eating whole food plant-based and my bone density went up. I have no medical background, but if a medical expert recommends exercise and whole food plant-based diet to maintain bone density, I'd be an example of that method being effective. Thank you so much, Colette, for putting that in there.
Yeah, and I just want to emphasize with exercise for bone density, what's so important is resistance training, so strength training, in particular, like lifting weights and trying, if you've never weightlifted before, trying to get on a program where you learn how to lift heavier weights. So not 1 to 2 pounds where you're doing 40 reps, but you're getting to a weight limit where you really can only do maybe 5 to 12 reps, because that's going to build your muscles, which are pulling on your bones, which is going to help strengthen your bones. And then the second piece of exercise that's so important is for bone health is some sort of kind of plyometric exercise, which is jumping exercises, jumping jacks. I know we have older people, so it could be assisted using bands to assist you doing some kind of jumping jacks, pogo jumps, even plyometric push-ups on your knees where you push your whole body off and you're landing with some sort of impact on your bones is really, really quite helpful as well. So so walking at a moderate pace is not necessarily going to do it. You kind of need that impact going on to incorporate that into your bone health exercise program.
And this is kind of along the lines, but talk about muscle. And Carol, it says, I've adapted a whole food plant-based diet. How do I maintain muscle as I age? How do I protect my bone health when whole food plant-based eating tends to lead to weight loss? I find it difficult to eat enough calories every day. And thank you for your suggestion.
Yeah. So so this is an area where I will tell you I differ in opinion than some of our whole food plant-based legends that I have great respect for, like Dr. Esselstyn and Dr. Neil Bernard, who really talk about that we don't need to be eating so much protein, that we can only need to be eating 0.8 grams of protein per kilogram of body weight. That is the minimum recommended amounts of protein to kind of maintain vital functions. Unfortunately, as we get older, after the age of 40 for both men and women, we start to lose muscle mass unless we're working really hard to maintain it. And for women, once they get through the menopausal transition or even in that perimenopausal age, that muscle mass decline accelerates. And for men, it accelerates as their testosterone levels start to go down as they get older. And so really, if you look at the data from muscle and protein experts out there, we really need larger amounts of protein. So especially for people over the age of 65, I tell them that we really want them getting at least 1.7 grams per kilogram of body weight, even up to 2, which puts them somewhere around 1 gram per pound of body weight. Doing that on a plant-based diet for certain people is easy for them, depending on how tolerant they are of beans and legumes and how much they like soy products and things like that are protein heavy plant-based sources of food. But honestly, for certain patients of mine, and I know I'm on the PB now, who can't do it, and their frailty and the osteoporosis and osteopenia is a bigger threat to their longevity, I do have them start to add back some animal products that the data shows really are neutral or possibly healthful. Uh, and so non-fat fermented dairy, so non-fat Greek yogurt is a big one. I tell people to start incorporating back because they can get 22 grams of protein per serving there. The second one being high omega-3 fatty fish a couple times a week to try to get their protein intake up so that we avoid sarcopenia, we avoid worsening osteopenia, osteoporosis, and then really try to focus on strength training for them. So again, it's an individual approach I take to people. I don't believe that there is only one diet that is the perfect diet for every person. We are all individuals. We have different health needs and health concerns that change as we change over time throughout our lifespan. So that's what I recommend.
Thanks. Colette has a comment here. I think, yes, Dr. Walsh, wish more doctors would teach us or send us to PTs and dietitians to teach us, and wish Medicare would pay for these services. I can't imagine that the medical costs to Medicare would not go down. I was only able to go to whole food plant-based because of online groups like this, as my doctor could not find a way to refer me to a dietitian for excellent or for expert advice on whole food plant-based. Well, Dr. Welsh can certainly help in that regard.
Yeah, it's very difficult. I don't have a nutritionist that I can send my patients to in the health system, our Freighter health system, other than ones I send for people with very high triglycerides to get on a low fat diet. But I don't have a plant-based nutritionist at this time. I'm hoping that will change over time, but it's very challenging.
And in January, I think we have one speaking. It's a long time for anybody to wait to ask a question, but there, of course, Joy Lenz, who we've had on before. If anybody is in the area here, is a plant-based nutrition or dietitian, and Allison Tierney, also, if anybody has an interest. Carol says, what recipes foods help children eat whole food plant-based rather than the sad diet foods readily available even in school lunch program?
Yeah. So this can be very challenging for families if they have picky eaters, if their adult partners living with them are not on board. It can be a real challenge for people. So when I changed my kids' diets, it was fairly smooth. There wasn't too much of resistance, but my younger son didn't like meat and he didn't like cheese, so he was pretty easy. And my older son at the time, like, if it tastes good, he'll eat it, so it wasn't too much of an issue for me. But I would start, they didn't want to eat tofu and things like that, so I started breading it and air frying it and gave it to them with ketchup. Not that ketchup is helpful in any way, but it was a way to get them to start eating it. And I just said, it's just like chicken nuggets, it's tofu nugget, and had some success there. But I did a lot of just expectation talking to them. And my youngest was 5 at the time, and my older son was 10. And I did a lot of talking to them about why we eat and what the point of food was, to fuel and nourish our body. And it's not, the point of eating is not to feel like you're eating an ice cream sundae or pizza or at a restaurant every time you put something in your mouth. And I still say that to them to this day. I said, food can taste good enough. I don't eat food that tastes bad, so don't get me wrong there. I don't. But I also don't need my food to taste like I'm eating out in a restaurant every time I eat. So a lot of it is mindset, and a lot of it is just to keep trying. And as your kids get older, it's easier because you can kind of appeal to a more logical side with them. But in the beginning, it's kind of getting over the emotional connection and expectations and dopamine hit that they're getting. And also, it's honestly not buying junk food. So like, I don't have junk food snacks in my house. My children don't want their friends coming over here because of that. And they say to me, why can't we have normal family snacks? And I said, I do have normal snacks. I have fruit, we have cut up vegetables, I have hummus. You know, I do compromise with them a little bit on certain things, you know, and we'll have tortilla chips and salsa, and guacamole, and we'll make guacamole and things like that. But I don't buy goldfish, and I generally don't buy baked goods and sweets and things like that. So not having it around helps, because then they don't expect to be having it. But you know, it could be challenging, and I definitely had many failures with them. And my older son is now a teenager and has completely rebelled against my way of eating. And so I had to compromise with him, and I said, well, in my home, you will eat the food that I make, which is going to be whole plant foods. And outside my home, you're old enough to make your own choices, and I won't. I'll try not to give you a hard time about that. But I again talked to him about why we eat the way that we do in my house, and I hope eventually he'll come back around. But I also don't want to destroy my relationship with my son, or foster eating disorders or anything like that. So it's you know, it doesn't have to be perfect. You know, you do your best, and hope that as your kids get older, the why of what you're doing will sink in, and they'll make the choices for themselves.
You have time for 5 more minutes, maybe?
Yeah, that's no problem.
Lightning round here, and I'll try to go through these as quickly as possible. Jill mentions I get great guidance from Has Fit, free exercise, all different types of pre-workouts online, smart TV. Anne mentions I would appreciate suggestions on getting a protein. You talked about some of that in just a recent question, as well as your thoughts on soy.
So yeah, so the soy piece, soy in minimally processed form, so tofu, tempeh, seitan, edamame, is quite helpful for us. Great source of protein, great source of polyunsaturated fats, great source of calcium. I eat a lot of soy. I love tofu. I eat a lot of tofu. I eat a lot of seitan, which is soy protein plus vital wheat gluten. It's very high in protein. So if you're really looking to get your protein up, that's a pretty easy way to do it, is to eat seitan. Edamame I snack on, or throw in salads, or if I make something with grains. So soy, the harmful effects of phytoestrogens in soy, that data comes generally from rodent studies, where they were giving them super physiologic doses of phytoestrogens, saying that it was causing harm. So we're not rodents, and the amount of phytoestrogens we're getting eating soy products is not even close to what they were giving these rodents. If you're eating textured soy protein, or something made from a soy protein isolate, they actually take out the phytoestrogens, so there are no phytoestrogens in those foods. So you're not going to be harmed potentially by eating too many phytoestrogens if you're eating soy protein isolate.
I don't know if you've got a 15-second answer. And if Carol asks, what is glycohemoglobin?
Oh, sorry, glycohemoglobin is
Pardon me?
A1C. It's your hemoglobin A1C. That's the percentage of hemoglobin that is has glucose on it. It's a 3-month kind of indicator of what your blood sugars have been doing. We use it.
What's a good number?
So a normal number is less than 5.6%. So anything less than 5.6 is normal. 5.6 to 6.4 is pre-diabetic range. So you have insulin resistance and pre-diabetes, and then greater than 6.4 is full-blown diagnosis of diabetes.
There's a question. There's some nice compliments here in mentioning that your patients are lucky to have you. Do we still need vitamins? Barbara asks.
So if you're eating a mostly whole food plant-based diet, you certainly need to be supplementing with vitamin B12. And the amount you need depends on your age. And I can give you a reference slide with that data. Dr. Michael Greger talks about vitamin supplements and in particular B12. So you could probably just Google him and you can pull up his reference to that. Other than that, you want to make sure that you're getting enough iodine. If you're not using a lot of salt or you're not using salt with iodine in it, my multivitamin has iodine in it, so I get the minimum requirement of iodine. Vitamin D, because of our climate, you probably need to be supplementing at least between the months of like November and April. Again, Dr. Greger has great reference on that depending on your latitude about what vitamin D supplementation is. Ideal vitamin D levels are probably closer to about 60 rather than the kind of minimal 30 range. You can work with your own primary care physician to have that checked and to create a plan to get you to more optimal vitamin D levels if you're concerned about it. And then omega-3 fatty acids, not necessarily for cardiovascular prevention of heart attack and stroke, but clearly seem to benefit cognitive function over time. So I take an algae oil supplement as well. So.
And last, there are a number of other questions, but we'll make this the last one from Susan. It says, what about using vegan protein powders with a glass of almond milk? And she mentions almond milk from Costco has about 600 milligrams of calcium per cup.
Great. Yeah, so it depends on your preference. If you're having a hard time getting protein, I mean, in general, it's always better to eat your protein from real food sources rather than, these supplements. But it can be a good way to help boost protein for people, especially people who are, don't like to eat a lot for breakfast and are like kind of skipping protein in breakfast, where it's really pretty important to be getting protein early in the day after you've been fasting all night. I would just tell you have to really read the labels and see what's in it, because a lot of them have added sugars or sugar alcohols and lots of things in there that maybe necessarily you don't want. So there are what I consider more healthful protein powders out there that don't have all that extra stuff in them that you could look into.
Thank you, Dr. Welsh. I'm going to, as a quick reminder to everybody here, our next monthly meeting will be Thursday, November 14th at 6 o'clock Central Time. Our featured speakers will be Ann and Jane Esselson. If you'd like to receive notice of this or other upcoming events that are not currently on our list, just Google us at PB Now, where you can subscribe and receive email notice of our upcoming events, or you can check us out on YouTube at PBNOW to watch past talks, and the entire talk would go through the areas that are of particular interest to you. Thank you again to our speakers, Melanie Manuel, and to our featured speaker, Dr. Aimee Welsh, for sharing your valuable time and knowledge with us tonight. Thanks for coming, everybody. Good night, and hope you can join us next
Thanks for having me. Bye-bye.